No. I didn't get a lot of bruising.
Yeah, put your hand over your head. Oh, thank God, yeah, it didn't bruise at all.
No, but it
Sensitive,
thrives
right?
from time, yeah. And I want you to know that I'm going to confess something.
What's that?
I signed up. I'm a subscriber to Relay Health.
To who?
Relay Health.
What's Relay Health?
It's where you can get your medical records.
Sure.
So I saw the pathology report already.
Don't cry. Don't cry.
I saw
Don't cry.
I saw it already.
No, stop that.
It was released to me.
Stop that. You're gonna be fine. Stop that. The first step, first of all, breast cancer now is very often it's considered as chronic disease. All right. People don't die. It's not like pancreatic cancer.
But my back hurts too, and I'm wondering why my back hurts.
Before you jump the gun, all right, what we need to do is we need a lot of more tests. We need to get an MRI of your breast to find out how extensive it is. 2 is we need a PET CT scan to find out whether your back pain is related to this or not. And most of the time it's not, all right? So,
but it only started when this started.
Yeah, a lot of things start, but don't do that to yourself.
I just don't understand. I go to doctor all the time.
And
another doctor checked me just 2 months ago.
That's the problem with this thing. The tumor cells goes, shh, don't let anybody tell you. Don't tell anybody that we're here. Very often, that's the reason why, whenever you have a test, you don't rely on it 100%. You do your best self-examination. I don't know when this started. It's possible it's recent. It's possible it's been there for a long time. If it's really wasn't there before and just started, of course, that's not a good sign. That means this is growing very, very quickly. Because you have very large breasts, and you have nodular dense breasts. It's not easy to examine it. So it's possible that it was there, but it was hard to find it, which is better.
But I always get an ultrasound done with the...
None of this is 100%. Very often they have...
And then I'm mad at myself, like I'm taking all these estrogen things, and then
don't kill yourself and make all.
But then I saw...
First of all, we have to find out how involved it is. What's the size? Whether...
It's big. We already know it's big.
We don't know that all of it is cancer, right? Some of it may just be reactive tissue, all right? Sometimes the size doesn't necessarily correlate with the outcome of the treatment. Don't do this to yourself, all right? Let's find out.
What's crazy is besides this, in my back, I feel fine.
That's good.
I don't feel like sick at all. I would have never known I was sick until I found that. I feel healthy.
Do you want it so that you have liver problems, you have everything? Because
but my stomach is hurting.
To their brain and everything else.
But now my stomach is hurting and I'm feeling...
First of all, it doesn't go to the stomach very often, all right? So that's probably not even a fact. But before you start killing yourself with a heart attack...
My husband was mad. I read it.
I was upset because I said you should wait for the. Have you read the report yet?
Of course he did.
Okay. My whole thing is like, you should let him explain to you.
I was
further, just because you know what, you're gonna sit here, Google all these words.
But I'm one of those people.
That's the reason. 2 things. All right. One is we prefer patients not to find out for themselves exactly what you did. And number 2 is I don't want to give this report over the phone. Why? Because you need to have somebody stand in front of you and try to explain things to you in detail, all right? Because you say, hello, yeah, you have cancer, boom. You don't like that. It's not fair to the patient, right? The doctor has to be in front of you.
And my back hurting me, I'm like, oh, something's else for my back.
Exactly right. Now, before I start going on, I guess you have relatives and friends?
Yeah. Everybody from my church.
Church?
I don't care who sees my boobs. That's my mom and dad.
I'm just, sometimes it's good to have support.
They're prayer warriors for me.
I know, it's good for them to pray. The worst thing you're going to have now is you have so many friends who are trying to give you advice.
They're not.
No.
They're telling me to listen to you. They're telling me to listen to what you're saying.
You know that church goer who sits in the front pew? Well, she had the same thing and she's dead after 2 days.
No.
You know the one in the front? She had a mastectomy and she's gone now.
No, you know what?
You want that one here?
No, you know what everybody said to me? They've said that in our church we've had this and they're healed and they're here.
You're right.
So it's not the same thing as if I've never. And let me tell you, the one thing.
But some of them are well-meaning. That's the point I'm
making.
But
let me just say one thing that's clear is that even through prayer or everything, I don't feel like I'm dying from this.
Good.
I don't feel like, I feel like something's
Good.
wrong,
Good.
but I don't feel sick and
That's
like
God
all
talking
this
to you,
stuff.
telling you, go see your doctor, and you did. We examined you once. I didn't say, don't wait 6 months, don't wait 3 months. I said, let's do the biopsy. Boom, we have an answer. Doesn't get quicker than that.
Is it okay if they can come in?
If you want to, I'll have them. I've got 7 of them right.
I'm okay. Everybody.
No, we just need a little space for them to sit.
Got I have my daughter
No, they can
here.
stay.
Your daughter definitely could
My
stand.
daughter. I have my parents. I need these are people.
Your daughter and your parents should be here.
But these are people. The other people are people who are the people that when I get low,
Yeah.
I had to be sedated some days. No,
Okay.
It was really bad. Sometimes her
agree.
emotions were so high
I
that
agree
she had
with
to just take these
All
meds.
right, just so we could have a meaningful discussion.
I will.
Yeah, no. Can we have just your direct family instead? Your mother's here, and the daughter's here. They think.
I need my people.
She needs her people.
All right, let's bring them in then.
You want me to get them?
Yeah, please.
Thank you very much, Doctor. I
Sure.
appreciate it.
And like I said, I'm a techie person. I'm with technology. So Relay Health gives you all your medical records.
Right.
And because I had thyroid cancer, I keep all my, every time you get a blood work, it's sent it to me. So
It's
saw.
a good thing you are, but
So I saw that it was an original one. And it's okay.
I'm the clergy.
The clergy.
That's her mom. That's her mom.
Oh, hi.
I said, I don't want anybody seeing my boobs. I don't care.
We'll let-
As long as y'all don't mind seeing them, I don't mind.
Hi, how are you? Hi. Oh my goodness.
I told you she had the whole village with her.
I'm the daddy.
You did that.
But
You're important here.
The reason why it was important is because these are people that are going to be supporting me.
Okay.
And I need us all to know the same information.
Right.
Because when you're emotional, you can't remember everything. And,
Right.
and that's why I need it.
No,
He was only
appreciate that.
concerned that some people would be like, oh, this person, she out of here. I said, not one person spoke that unto me. I
Okay.
spoke
I
life
just
unto
gave her a
me.
word of caution because even among physicians, among breast surgeons now, there's no unanimity in a one set of treatment and that's it.
Right.
There are so many options now that very often the patient will decide what to do. I think it's very unfair if sometimes somebody tells her, Mrs. Smith, who sits in the front row on the third pew, well, she had this and she was dead in 3 days, or somebody had a mastectomy, so don't have a mastectomy because that one didn't do too well, or don't have a lumpectomy. It's not fair for her because it's so different for everybody.
I have had big breasts for years, and so the fact of me to have something smaller than these is a good thing for me. And if it has to go, it doesn't belong there.
Right.
And it has to go. And I'm married to my husband. My husband's gonna love me whether it's that he got breasts. So, but
Daddy got breasts too.
I'm glad that you understand this very well. And you have a proper attitude.
You know what the problem for me? It's not, like I told you, I don't feel a death sentence over my life.
Okay, I'm glad you
I
have
feel fine except for the back pain.
Right.
My problem is the going through. Because I know when I had a thyroid cancer, I had to go through some stuff. And it was rough.
Right. But what I don't want you to do is sometimes having a lot of information and processing it without really getting the proper
I tried
diagnosis.
not to, but I went into like a
I mean,
panic.
you broke down when you came in here, and I haven't even told you.
I had to tell you the
how
truth.
far it is and all that.
But I gotta tell you the truth about everything.
Oh.
Gotta tell you the truth that that I saw it on the internet. I saw the report was released to me.
Right. Well, see, you had that information, and you're broke down. You're correlating your back pain, your stomach pains, and this pain and that pain. It's all over my body, and you're already creating problems that we don't even know exist. All right.
Okay.
So you're making yourself suffer for things that and none of us here is privileged to know yet. All right. So just very briefly, you do have malignancy. It involves the ducts, which is the tube that carries the milk from your factory, which is called the lobules, into your nipple. That's the most common cause of breast cancer. Now, how far it's gone, how locally, what the local size is, how invasive is it, are the lymph nodes involved, what stage it is, we have no idea. All we don't know is that we took several cells, we know that this is cancer, all right? Now, Your ER is positive, is negative. Your PR is negative. We're waiting for you. Those are estrogen receptors, progesterone receptors.
And the HER2 is pending. What is it?
HER2, but if it's a triple negative, that means it's a more aggressive type of tumor, and very often these patients would either benefit with the chemotherapy before or sometimes after, or almost definitely, if not before, then definitely after the surgery. All right. So we know a little bit more about the behavior of these cells. We don't know everything, but we do know that if it's a triple negative, your HER2 the receptor is negative, then you will benefit with medications. All right. So now, first of all, we got to know is how locally involved is it? What is the size of that tumor? Are there other areas in the same tumor, in the same breast, or are there other ones in the left breast that we don't know of? That's why the MRI of the breast is very important, all right? So another thing that we got to do, we got to find out why you have your back pains, your stomach pains, your ear pain, your big toe pain, and all that. So we got to do what's called a PET CT scan, all right? That's an injection of a dye, and the tumor cells normally eat it up. And then when you take a scanner, it will then light up like a bulb. And then it makes us aware of certain areas that are suspicious, and we can chase them with biopsies in different areas.
Is that the contrast, like the IV contrast?
Yes.
I'm really allergic to it. I have to have a Benadryl like drip through it because I get hives all over.
Right. Now the question is it from the iodine or is it from something else?
Well, whenever I get like a MRI done, if they give it to me, even if they give it to me before, I'm still gonna itch and get hives, but at least it's manageable. I don't know.
Right.
So I need.
Well, we can eliminate those, but it's a critical.
No, it's critical. I mean, I need it, so I'm just
very,
telling
very
you.
important for you. What you got to do is when you go for your test, you got to tell the radiologist as to what type of reaction you had, because what they can do is they can give you the Benadryl before they inject it.
They did that, but in the pill. But I need to have like a IV Benadryl to keep it, like to get it
Fine.
right in
But
there.
it's important for them to be aware of it,
Okay.
so that they can do something before you develop a reaction. All right. In other words, if you develop diarrhea when you eat pasta, what they do is they tell you to take some Lomotil before you take the pasta, and then you eat it, then you're okay. So if you develop a reaction to certain types of dyes, they give you the injection and the oral medication, and very often you do well. If you can't have it, we're not going to do it.
No, I'm glad I have it.
Yeah,
Because
but I think it's very, very important for us to know exactly how involved it is, because the mammogram, the ultrasounds have not been helpful for you. All right, so we need the MRI to be able to make this diet to better assess the breasts. All right. The PET CT scan is very important. Then again, I have to talk to them about whether these two dyes are related to each other or they're not, because then they might have to do exactly what they did for you when they do this procedure. Once you have that, you then need to come back to the office and we'll put it all together. Once we have that, then we have to decide as to what kind of treatment that's available for you, and then you can make the decision together with your family and to discuss it as to what's important for you and what your priorities are, and then you can design a type of procedure and treatment that is most acceptable. Not the life is all about good life is all about having choices, and hopefully we will have those choices. All right. So, but we can't tell you what those choices are until we have a better understanding as to how locally invasive it is, what the local size is, whether the opposite side is involved or not, and whether this has gone somewhere else.
I thought that I read that it said that it is poorly. So it somehow is that
Poorly
being
differentiated. This means these guys are athletes, and they're trim, they run fast, and they're antsy.
And that also that it some of the, since I guess the biopsy, now I know why you took some around it, because you did it around the margin.
Yes.
Around it.
Yeah, but
and
we're
to
not
look at
going
it.
through. This is margin. Can you imagine how much space this is in here?
But it showed
if
that
you only take a little piece of this, what about this, and that,
Okay,
right? It just
okay.
tells you a little bit about the margin, but it doesn't really tell you the story.
Okay.
Okay, so I'm going to write some, before, we're not in a position to offer you anything now, because we don't know what is proper to design this. In other words, if we just have your height and weight, we don't have the length of your arm, your neck, and so forth, we can design a dress for you, right? So we have to have the proper measurements in order for us to be able to have a very beautiful dress made out for you, and then you can hopefully fit into it, and hopefully the outcome is going to be great.
My biggest concern, my back really, really hurts.
I understand that, but that could be, it's like having I have a headache, and I say, I got a tumor in my
But
brain.
it
Everybody's got a headache. I got a toothache. I got a cancer in my tooth.
but it just like it just came together at the same time. And what about the throbbing? Oh, what do I do? I put ice on it like you told me. I do the ice, but it throbs.
If you try to correlate with the pain, I told you with the problem with cancer, cancer cells tell you, shh, don't tell anybody we're here. All right? If you present first with pain, if you did not have a lump and you came here because you have pain, then I say, I don't have to check you, you're okay. But if you came in and said, I felt a lump, but I don't feel anything, that is bad. All right? So, all right, don't jump into anything, all right? The pain there could be a million different causes, different reasons.
What about the blood flow? I saw that when I got the mammogram done, the ultrasound, there was on the outside of it, there was some blood flow, and I know that blood is what feeds it.
Well, it needs some source of oxygen and some
Right.
food, and that's why what they call neovascularity. It creates more blood vessels to be able to feed that tumor.
Optimally, how soon will everything get done?
Depends on you.
No, I'll get done
I'm
quickly.
going to write the script. It's up to you how fast you can run to those places, how soon you can force your way. Says, I need this done right away. And talk to them. And if you can't get it done there, I'll go somewhere else.
Is there always a treatment plan for a woman?
Absolutely. You're not going anywhere fast.
Is it a good sign that I feel healthy besides this?
Well, you know what? Attitude is a very, very important thing. If you have a very positive attitude and you got prayers backing you up, and you have a saint who's going to operate you, St. Augustine.
All right, St. Augustine.
There you go. Hallelujah. The Lord found the Savior to you. All right. Smartest saint out there in heaven.
Yes. Okay.
So
And you have the Reverend here. My goodness, what else can you got everything covered.
That's
you
another reverend.
Oh boy, you got two
They're
reverends.
evangelists,
Oh my God, don't forget it.
Yeah. So doctor, do you know exactly what size it is? You don't know.
No,
what
that's
size
the
it
reason
is?
why we're getting the MRI. That's why
Oh,
we're
because
getting-
so when we saw the 5, like the 4 and then the 1, that doesn't mean that's as big as it is?
Well, it is, but it doesn't give you the whole picture.
I'm missing that.
Well, I take a picture here of you, and they just shows your face. How much does she weigh? How tall is she? I
Right.
don't know.
So
I
there's
just
a
took a
lot to
picture of the
show.
face.
The exact size of it. then.
Yeah.
Okay.
Oh, because you were saying that all of it doesn't have to be that way. You took pieces of it. You got to look at the whole thing.
Right.
And that's done, I guess, once it's extracted. And
Right, and the
Pathology.
MRI sometimes gives you a better accurate picture.
Okay.
Sometimes not everything you feel is cancer. Sometimes some of it is just fat, but some of it is just fibrocystic disease.
And is there like also like with the back pain, do some things when you have something that happens in one spot have like a secondary like you would get pains because of that? I didn't know why my back hurt. My back has never been on fire like
We'll
this.
have the answer
It
for you
hurts,
soon.
but it's hard to like
Understood.
rest and sleep. It's like it aches a
Understood.
lot.
Understood. I hate to say this, but the weight has a lot to do with it too. I mean, there's a lot of strain in your muscle and your spine and so forth. But having said that, we don't know it is related to the breast, and that's the reason why we're getting all this tests.
Who is part of the team that makes the care plan?
I myself, and there's 3 of us. We're going to refer you to a medical oncologist and then a radiation oncologist. So it's a team effort. We need to look at this first, second, third opinion, look at it from different angles. It's a multidisciplinary problem.
This is a little off topic, but should I be worried? I'm her daughter. Should I be worried?
A little bit. She's not 28 years old.
No, I'm saying for
No, no.
myself.
I'm saying this related to your question.
Mm-hmm.
If she was a very young person and she had cancer in both breasts,
Right.
the answer you should be very worried. All
Okay.
right. Fortunately, she's not 28 to 38 years old, and the fact that you have a first degree relative with developed breast cancer automatically puts you in a level that's beyond 12.5%. Because it's 1 out of every 8 women who develop breast cancer. That's 12.5%, and during their lifetime. All right. And after we're done with her, we'll find out more a little bit about her tumor and so forth. And then we can think about doing some genetic testing for her and maybe some genetic testing for you,
I have 2 daughters.
for both of them.
Okay.
Now, we hear
Alright.
about stages. Do we know what stage it's in?
No, absolutely. The staging is TNM, tumor size, nodal metastases, distant metastases. Like I said, we only took a picture of her eye. We don't know what the rest of her body looks like. All right.
And the tumor size is intact. You remove it, and do the
You're-
whole pathology of it?
You're 20 steps ahead of us. All right. Let's take it a step ahead.
No, but I was saying, you're saying TM, I'm saying
TNM.
tumor size is like when you actually have
tumor
the,
size when the tumor is
it's
removed,
taken out,
then
you look
they
at the
will
whole
measure
thing.
exactly
That's what I was
how much is
asking.
involved, right, yeah.
To see how much, because some could be fibrocystic, like you said, right?
Sure.
And then some, or all, whatever percent.
Absolutely.
Okay.
Okay, so
All right.
all right, don't overread everything. All right. Trust in the Lord. Pray that He sent you here. We know there's a problem, and all we need to do is find out how to treat it. 2 ministers, my God, it doesn't get better than that. You got both sides covered. I guess you pray for the left breast as He takes it away.
I pray for the whole body.
So you're saying since this breast is dense like that, you really can't see through it with like a mammogram and
The MRI should help
ultrasound.
us with that.
You really need to go in, and MRI looks at every little, like pixelated.
Very, very sensitive.
Yeah.
Okay.
And it said like the milk ducts is where it start like that. I was seeing that's the common kind where it starts there.
Sure.
Okay.
Okie dokie. You're gonna have a great lunch now?
Calm down, stop worrying. You said take a
I'm actually
step
doing
at
pretty
a
good.
time.
We'll worry
Step
about
at a
you
time.
afterwards.
That's all it is. It's like life. Take it a step at a time. It will kill you, and you won't die from that. You know. So you be like Daddy, tough.
Sorry for telling you my kids.
Remember, I had cancer too. Don't
It's gonna be fine.